provider side and on the business associate side as well. One of the things that Cliff had asked me to talk a little bit about is the data breach investigations report. Has anyone heard of that? So what the DBIR is it's a compendium, if you will, of actual data breaches that happen. So Verizon, we teamed up with about 18 organizations all over the world, mostly law enforcement organizations and other public sector agencies, folks like the Secret Service, the NCIC at DHS, Interpol, Metropolitan Police in London, the Dutch High Crimes Unit, 15 others as well. And we looked at all of their caseloads, and we've got a framework called VERIS for sharing incident information across organizations, which is why you don't often hear about organizations like this sharing information with each other, and we managed to get information from 18 of them and bring it together. And all told, we looked at about 47,000 incidents that happened in just the year 2012. And based on that, we identified 621 confirmed data breaches. And so what the DBIR really is a compendium of how do digital crimes actually happen. So there's no editorialization, there's no survey data, it's 100% based on actual facts. So the evidence and what it says. So I'll spend like a couple minutes just talking about some of the key findings in the DBIR, and I'll break it down into the why, who, how, and what. So we had to ask the question, why do data breaches happen? The number one reason that data breaches happen is because there's some third party that sees value in stealing some kind of data that you have. Of course, in the healthcare context, PHI is going to be one of those types of data. The second example anecdote that Cliff mentioned, certainly that was the case. But it's not just that; it could be other things too. I was a couple of weeks ago. I was not too far from here. I was meeting with a trade organization for 34,000 healthcare professionals in a specific discipline. And so I was talking to them, and I said, why do you care about security so much? You just have PII on your healthcare professionals and your, the trade organization for this specific discipline. And they said, well, it's not just that, but we're also looking at things like we're doing trials with different vendors, and so we have intellectual property that's worth a lot. That's worth tens, if not hundreds of millions of dollars. So they also have been victims of espionage attacks from the Chinese. So don't think it's PHI is the only thing that's worth protecting. Certainly from a privacy standpoint, it's all about the privacy of people, but if you look at it from an organizational data standpoint, it's more than just PHI. So that's the reason organizations get attacked. In fact, the number one reason they get attacked, if we look at the data, in 61% of the cases, it's payment card information, right? Because people steal money, right? That's what they want. They're typically crimes. About 75% of crimes are financially motivated, versus about 20% are espionage, and then just a few remaining are all about hacktivism. So those are the reasons why organizations get attacked. So the next, the who would be, who would attack the organizations? Well, if they're financially motivated, which 75% are, then it's typically organized crime. That's who's attacking these victim organizations. And then if they are about state-sponsored terrorism, and they are about industrial espionage, so it is spies, it is the Chinese, it's the stories you've heard. The Chinese make up about 96% of all espionage attacks that we looked at last year. The third question is, how would they attack me? Well, that really depends on who's attacking you. So the financially motivated attackers, those tend to be what we call opportunistic attacks. So they're going to go and find the easiest way to break in. So they're going to be looking for the low-hanging fruit, that proverbial weakest link in the chain, and they're going to go in and break in there. So to defend against that, which forms, again, about 78% of all attacks, it's pretty easy. So 78% of attacks are either of low or very low difficulty. If you're doing the basics, you've got a firewall, you're looking at the logs occasionally, you'll be fine. You don't even necessarily need an IDS or an IPS for more sophisticated stuff. For the espionage attacks, those tend to be much, much more sophisticated. We see things like phishing figure fairly prominently. I think something like 76% of the attacks, phishing was involved. In 78% of the attacks, it was weak or stolen credentials that were involved. In 52% of the attacks, there was some kind of hacking that was involved. So those are some of the the high points in terms of how these attacks happen. And then lastly, what do you do when you get attacked? Right, so the number one thing to do when you get attacked is don't get attacked. Right, which seems like a little bit of a cop-out, but if 78% of attacks are of low or very low difficulty, then the clear implication is you don't really need to do something sophisticated to prevent those attacks. PHI would probably be more often than not, unless someone is specifically targeting some VIP or someone's specific PHI. In most cases, PHI is PHI, and you're willing to steal. It's more about quantity than it is about the specific person's PHI that you're stealing. And if that's the case, they're going to look for the weakest payer or the provider to steal from. So you just have to be better than everybody else, which today the bar isn't set very, very high. So to do that is actually fairly simple. And then of course you want to have some kind of a retainer in place. So who do you call? What does 911 look like in the cyberspace? Right? Do you have someone you can call and say, we've had a breach, now what do we do? How do you contain the breach quickly? We find that in 36% of the breach cases, it takes months to just contain the breach. So we know the breach is there. It's like this house has been on fire for 6 months. So that's how bad the situation is in about a third of the cases. So Verizon, we've analyzed over 2,500 data breaches. Of the 11 largest data breaches that are known in the public domain, we actually responded to 9 of those 11. So we're pretty good at this.
Can I ask you whether you've done any analysis on the people who have been breached, whether they put the critical controls in place and were breached nonetheless because of the kind of information they had being attractive to particular attackers, and whether for PHI, I mean, it's one thing, everyone that's in the space already agrees that the adversary's in the network, but the question is, can they get to the specific data? Have you seen a trend since high tech of specifically trying to encrypt the PHI itself? So even if there's a breach, if they can get to the data, but the data is encrypted, they can't do anything with it, and there's no actual disclosure, so you don't have to spend the millions. Have you seen those trends, or have you analyzed it?
So when we look at the 621 breaches, if what was stolen was encrypted data, we wouldn't call that a breach, because in our
the data or the system, because that's
so for us, we're only concerned with data breaches, right? So at the end of the day, it doesn't matter if the network, the server, everything gets breached. If data isn't stolen, there's really no harm done, because the true impact is when data is stolen, right? The server is kind of worthless, so is the network. Everything is there only for the purposes of making the data accessible and usable and adding utility to the data, right? Because if you think about this, it's information technology, so the technology is there to enable the information.
Right. But I mean, to the extent that presupposes that everyone is vigilant about encrypting the data type in an organization, that's, from human behavior is not necessarily the case. So
yeah,
you would find it valuable as well to be able to let organizations know that even if in the particular instance they got to a place where the data was encrypted, that their systems have problems or their applications have vulnerabilities.
Yeah.
Sorry, I'm just going to keep an eye on top of it. But we have both Bill and Leo have been in the industry, and I'm actually going to turn it over to them after Peter. But I think one thing I'd like for you all to address is just specifically how much are we seeing encryption of data rest in the industry, and to what extent is it being leveraged. I think one of the really interesting things for me, I rely on the DBIR heavily as a security professional. And what's interesting to me in healthcare is you heard Leon Rodriguez speak this morning, and I think he did a great job. But he cited the number one cause of breaches was the loss of a device, a portable device, right? And what's interesting is the DBIR takes the perspective of, I don't think you really analyze the data unless the data has essentially been breached and been used for malicious purposes, or being available for malicious purposes, right?
So as long as the data has been breached, it'll be in the report. So we don't go as far as saying, how was the breach data actually used.
Yeah, but what's interesting for us, if you look at the Verizon report, is your organized crime is not going after individual laptops. They're not going after individual portable devices. It just doesn't. There's not a great return on their investment, so to speak, if they get access to an individual laptop.
Well, no, I would say that's not true, because the break-ins that took place on the West Coast where someone took a desktop computer.
Right.
Maybe not a laptop, but certainly there are millions of records on
So,
a desktop computer, which was on the other side of a window.
But this is the distinction I wanted to make. Did they take the desktop because they wanted the asset? They wanted the machines and sell the machines?
I think
If you look at
so why would you feel fine they didn't
So
have
that,
millions of?
that probably happened with me that you're talking about.
Oh, okay.
We had, that
Oh,
happened, we lost 20 desktops that I came in and stole.
Yeah.
the machines.
Wow.
They weren't after the data. They were after the machines.
They picked the new machines in
Right.
the offices.
Okay.
And that's the important distinction I wanted to make here is, the Verizon report is clearly showing a rise towards organized crime, towards data espionage. In the healthcare industry, we're vulnerable. Our focus right now, because of regulation, is on, a lot of focus is on encrypting these devices and making sure that they, at the end of the day though, this is not what's going to be contributing to major breaches. Organized crime wants to go after large sources of data
Well,
because
or very specific data.
Correct.
In APT, they're actually, some of the Chinese are stealing actually just business practices.
Correct.
Sure.
Which is not something that would be considered to be.
Correct. So oftentimes, if they are going after the mobile device, it's only going to be as a stepping
As a
stone.
step. Yeah,
Well, and you also have to remember, in the healthcare, when you look at the regulations and everything, I mean, you do have encryption of transport, encryption at rest. If it's inside your organization, you don't have to encrypt. When you're encrypted at rest is usually when you're going out and storing the information outside your own organization, is when you have to do that. So, to your point, not everything is being encrypted. Now, some organizations have had an issue and said, okay, we're going to encrypt. The biggest one is Blue Cross Blue Shield Tennessee. After their issue, they encrypted everything.
right.
But, I think you have technology concerns related around encryption, especially as the smaller the organization gets, can they actually do that and keep up with it? Larger organizations are able to spend money on it. So people have kind of criticized HIPAA over the years, and I guess, there's a lot of things good or bad, but I don't know if I could write anything better that covered from one person to 60,000 persons
Right.
and make it understandable and doable.
And it's not the encryption that's involved, it's the key management.
Exactly,
Yeah.
exactly, that's really. So, I'd like to ask Peter at this moment, Peter, if you wouldn't mind, just give me a kind of brief introduction, and then what I've asked Peter to do is just kind of give you a sense of, from an industry perspective, what we're dealing with from a regulatory standpoint. So the goal was for Omar to kind of give you a sense of what reality exists for us. Where are the threats, where are our exposures, and now, how does that fit into what regulations are driving us towards and compliance is driving us towards?
Yeah, I'm Peter Adler. I've been involved in privacy and security since 1994. As opposed to the winners of the Brandeis Award yesterday that are the big thinkers and the visionaries, I'm more boots on the ground kind of person, and I get the sense there are other people here at this conference that are also worried about day-to-day keeping information safe and secure. And so, I think what I'd like to talk about in my 5 minutes or so is sort of where we are. But by the way, my company now, I've been in law firms. I was a CPO, Chief Privacy Officer, United Health Group. I'm with the IT company that contracts with the government. So, and I'm the Chief Privacy Officer, but I'm also Senior Counsel for Cybersecurity and Senior Counsel for Health. And so now my view of health has changed a little bit. It's more, we have a health group that contracts with CDC and NIH and the VA and military health. And so we're concerned about when we build IT programs or perform government contracts, our projects that are doing it, are they doing it in a way that they're building for privacy? Are they doing it in a way that they're protecting the information entrusted to them by the government? That's part of the work. And then the other part is the corporate, taking care of our own corporation. And sometimes they kind of overlap because we made our corporate network what's called FISMA moderate level secure all across the corporate network, because our customers want it to be at least that secure, sometimes more. But we decided to build ours to look like theirs so that we could store the information and work with them and have our projects stored securely. What I'm seeing right now, both inside my company and also on some of the projects, is a movement towards data governance. And you know, we have to be really careful about language in privacy and security, really careful, because there are so many different disciplines outside of HIPAA, and even working with the government, you're going to have, if you're working with the VA, you're going to have HIPAA, but you're also have the Privacy Act of '74. You're going to have memoranda out of the OMB that you have to follow. You have regulations of the agency, and so you somehow have to put them all in and stir them up and come up with a program that's going to allow you to secure the information, and it can be very confusing. When you talk about data governance, it's again one of those, like big data and all the other terms we've had the last couple of days, it means a lot of different things to a lot of different people. So I thought I would explain to you sort of what I think data governance is, and you can take it for what it's worth. Good thing it's a free conference. I don't know how much it's worth. But the idea here is, if you think about it in terms of where we've been and where we're going, you might be able to kind of get your head around a little bit. Where we were is we were control freaks. And it was easy to do because we had our IT shop, and it was here, and we knew where it was. It might be locked. Hopefully it was locked, and physical security was in place, and you knew it was there, and you had the perimeter of the organization. And then all of a sudden we had concerns about vendors. Then we had concerns about other trusted partners. Then we had concerns about the internet. Then we have concerns now about cloud computing. And you can see that this control model that we used to use just isn't going to work anymore, because we don't have control like we did. And so data governance is one way to recapture the control. It moves it out of the lock and key and having it just looked at, you know, in a kind of easier, it didn't seem easier at the time, but the easier way, to creating the governance, a model where you have people, stakeholders, often called in an organization, that are going to help in the protection of that. And they may be a group of people. They can come in lots of shapes and sizes. You can have, in our organization, it's the Chief Information Security Officer, it's the lawyers, Chief Privacy Officer, some executives that are concerned about data, some of the project team leaders are all part of that. And then from that, you decide how are you going to protect information. And you create data stewards, and they're the ones out there that are actually working on it. And there are different models. And I'm not saying one model is better than the other. What I do suggest is that you look at your organization, learn a little bit about the models, and if you need some help, I have a slideshow I can, if you give me your card, I'll send it to you, to help educate other people in your organization about what data governance is. And then you can pick and do sort of a data risk analysis. And you want it to be for the life of your data. So it's from the time it's received and created to the time you send it out for destruction and everything in between. And the reason why that works for organizations is because it allows you to control things that you can't see all the time. In healthcare, or in healthcare is moving in the cloud, and rightly or wrongly, the cloud has been identified as another business associate. And it's funny because it's actually more than that. Just like the FFIEC also said it was a service provider. It's like, it's more than that, folks. It has to actually be a more trusted partner than even a vendor. And part of what you do is, say you're selecting Amazon Cloud Services or what's yours, Teradata or something. You need to, you go from this idea of, hey, I want to look inside, I want to monitor, I want to control what you're doing with my data, to, and this is where the EU is going as well. Let us tell you what we've got in place, and you can rely on our representations that we're doing the following things inside the cloud, and then you take that and you then negotiate, if it's not enough, how you're going to deal with the data, but that you have to have a certain relationship with your cloud provider of trust but verify in order to make that work. And then in your organization, that can be done as well through service level agreements. And it can be done with service level agreements with the cloud provider. So you can control it with many agreements talking about what you're going to do with the data when you use the cloud or where you're going to host the cloud. And so all of these types of things are now being, it's sort of the next wave, I think, and I think I was talking to you before the thing. I know that you're worrying about governance, and I'm sure you're thinking about it too, and I'm sure they'll have some points on it. But that's all I wanted to sort of introduce, is the idea that this is where I think it's going, Cliff, from this point on.
Great.
It seems to be.
Thanks, Peter. Appreciate it. Bill, maybe I'll turn it over to you now.
You know, when I look at this, and I'm on the ground also, and I work now with a lot of different organizations, and we have to remember, privacy is done by people, security is done by people, and the errors, a lot of the errors I see are by people. And, you know, single individuals. Good example, apparently I died January 15th of this year. Okay. Got a hospital bill. I had just moved 2 weeks prior to an apartment. There's a whole story beyond that. But moved in, got a hospital bill to a hospital in another state that I had lived in 15 years ago. I didn't, you know, I thought, oh, I'll call the billing department, probably billing here. And then 2 weeks later, I got the physician statement. Had all the ICD-9 codes on it. So I thought, okay, let me take 10 minutes. Googled it. Found out the guy had died in the hospital that was billing me. Found out what he died from. Found out all his family members. Found out all this information, so I called the privacy officer. And after some investigation, what they had done, the gentleman had died. So they were trying to get the bill paid. So they did a skip trace on it. My name was the next one on the list. So I was chosen. That's how simple an error can occur.
Only probabilistically died.
You know, right. But, you know, it goes down to the fact, and you look at the technology side of the house and the security, you know, I was investigating one where we had an SQL attack, and the coder didn't follow this coding book. He had to do something quickly, he got it in place. You know, fortunately, in this particular case, the person was looking to do damage, not to steal anything. But it's very human error prone, and we have to remind, you know, I think people have to be reminded. Cybersecurity, I think, is important. We talk about it today, but, you know, for most providers, I don't think they really think about it at this point. Where it's going to get kind of down to the ground is when we start building out all these information exchanges. And all these states have information exchanges, and you have all this data that's just residing, and then people are going to try to get to that data. And we don't know today really how people can use that, you know, criminally. And, you know, and I'm always shocked at things. There was a story in the paper the other day of a dentist that sent out 17 years of x-rays out and signed a agreement with this company to image them and send them back. The company didn't exist. They got these x-rays and sold them to a silver recycler. You know, and I'm just like, I've never thought about that. You know, but it's interesting how people look and, you know, see these different things. So, you know, we can put the regulations in place, but ultimately, you know, there's people behind all this, and we're going to continue to see errors. And I don't think that we should accept that. I think we should continually work on it. One of the things that always nags me is when an organization does have a breach, they kind of put out the general statement of, you know, the CEO says, I apologize, you know, we value your privacy and we're going to look into it and fix it. And you see this over and over again. It's like, well, if you value my privacy and security, you probably have done something up front about it. And I'm going to say their name, but I thought it was probably one of the best statements I read was from Johns Hopkins. It was kind of a slightly different privacy. It was electronic privacy. But, you know, they basically said in their statement, any invasion of patient privacy is intolerable. Okay, you immediately knew where they're coming from at that point. The doctor's behavior violated our code of conduct and privacy policies, and it's against everything we stand for. Okay?
And they wrote that after they got breached.
And wrote that after they got breached. In their final statement, we regard our patients' rights to privacy and professionalism as a fundamental and foundational. You know, and why I say that is that we know from studies that when an organization gets breached, you see about an 18-month downturn in revenues. Okay, then people kind of forget, and then they start kind of going back and everything else. Looking at this statement from Johns Hopkins, you know, I would still go there. Okay, looking at all these other statements, it's like, I don't know if I really want to go to that hospital for a little while until they get their act together. So, you know, I want all, you know, everybody to kind of be like Johns Hopkins, to take this very seriously. Errors are going to occur, but take them seriously. When Leon Rodriguez was speaking a couple of weeks ago at the NIST OCR conference, you know, that was his point. Breaches are going to happen. It's how we respond to those breaches. You know, people are smarter, and as we put more in place, more security in place, they're going to figure out ways to get around it. So, you know, it's a constant game that's going to go on. I don't think we won't solve it in our lifetimes, but it's a constant game that's going on.
Thanks, Bill. Appreciate it. I'm going to ask Leo to share with you some of his thoughts, and again, Neil's speaking about front lines, as Leo indicated. You know, unfortunately, Leo's been on the front lines with respect to breaches, and is also on the front lines with respect to kind of healthcare reform. His organization has been at the forefront of the ACO movement, and so somebody that's really kind of in the thick of things and kind of experiencing the challenges of implementing security from a day-to-day basis.
So, good morning. I suspect most of you don't know who Healthcare Partners is or are. I used to say we were the largest private medical group in the country. Until a year ago, we got bought by DaVita, which is a public company, so we're no longer owned and operated only by the doctors. We continue to be operated by MDs. We have about 2,500, 3,000 employee doctors in our medical group, offices in Los Angeles, Las Vegas, Phoenix, Albuquerque, South Florida. We continue to grow by acquisition. It's been my job to try to integrate these systems together. We operate 5 separate instances of EHR systems. 4 of them are Allscripts implementation, 1 implementation of Epic. My job as the Chief Security Officer is to try to come up with a standard set of policies for everybody to follow, trying to make sure their technology implements those procedures, make sure that we can detect those breaches that do happen and respond accordingly. As people said, the breaches are happening by people. I don't think we've ever detected anybody trying to hack into our systems. We see people that try to surveil our systems. They're looking for openings through our firewalls, trying to get into some of the applications that we built. Never seen a successful attack that method. The number 1 breach we have in our company is employees looking at their friends and their neighbors and their coworkers. We get at least 1 incident of that a month. We fire 6 to 10 people a year. There's no tolerance for it. But that's the people issue, and I doubt that the Forensic Study sees any of those incidents being recorded. In general, we may or may not report that to HHS. So I suspect that's systematic throughout the industry. One of the things that we have implemented a service to look at, what people are accessing, what records are accessing, what patterns they've accessed. We allow employees to receive alerts from that system. My intent, and I've been saying this intent for a couple of years now, is to make that part patients to see who's looked at their records. And again, because I want to use the patients, the people whose record that data this really is, as my cop on the street. So, and that's where we're headed. There's some issues around that, you know, the privacy of the nurse's name, or the privacy, how do I tell one patient what a claims processor is? Those sorts of things are still out there. We're working through those, but that's certainly where we're headed. On the technology side, healthcare partners spend a lot of time. We not only have 2,500 employed doctors, we have about 13,000 contracted doctors, mostly specialists, that we send our patients to when they need particular care. We want to give those doctors our information that we have on the patients, but we have no control about what systems they have in place, what controls they might have on their desktops. Do they have a firewall? So we built a set of portals for them to access that information. One of the things that I think I'm most proud of over the last couple of years is I've implemented some security practices around the software development of those applications. We sit with the developers, we make sure we review their code, looking for the SQL leaks, looking for the cross-site scripting, making sure that they follow the standard procedures. But even with that, mistakes get made. Our most recent breach was a month ago now. We found through our review, our penetration testing of our systems, we found an improperly configured web page that allowed access to the internet to some messages. And now that was a mistake. The developer should have caught that and fixed it at the beginning, but they did not. We did find that within a couple of months of the system's release, so we restricted the number of patients that got affected by that breach. But it still happened. And our intent, the letter going out does apologize for it, does tell patients that we're serious about protecting their information, and offers them restitution to what degree as they want. In California, we've got a bigger problem in that California patients can in fact receive $1,000 for this. So we'll see how many people take us up on that offer.
Thanks, Dave.
I'm curious. Okay, so it's one thing if this woman, for example, was Googling herself and found there was a data breach, but I think about, for example, this big breach in Utah where almost 800,000 records were breached. And, who knows, decades from now, there could be some ramifications, but in general, and that was hackers, Eastern European hackers, I gather. So I have a couple questions. I'm guessing that there's a lot more breaches that are going on that we don't know about. But what becomes the clues that something big is happening that you start pursuing and starting to dig into the dots of where a breach might have occurred, and how can you go through those steps of how you kind of start looking at breaches and worrying about, whoa, is there a big one here? I'd like to think that there would be like the Richter scale, and you start seeing so what are the signs?
Yeah, maybe if I can just I'll just quickly address that, and then I'm going to turn over the panelists to answer. So we study breach data, try and kind of get some sense of what the risks are and where organizations should prioritize their efforts. And I used to look at a source called Data Loss DB, which is really a public forum that publishes information on breaches that are public, either being disclosed in public media or being disclosed to regulatory agencies and being published. And if I looked at that, I'm going to give these numbers, but just kind of give you an order of magnitude here. If you look at that data for about a decade, and they've been doing this probably 13, 14 years, if you look at a decade, I think they chronicled about 2,000 breaches over the course of a decade, globally across all industries. You heard Mr. Rodriguez mention this morning that we've had 600 major breaches, 80,000, I think, reported breaches since the passage of the HITECH Act in 2009 in one industry, in one country. So, so when I look at that, I think it's just the tip of the iceberg in terms of disclosure, in terms of understanding really what our exposure is. You know, like you said, probably a small percentage of breaches are actually disclosed, and so I think if that's any indicator for me, and it's tough to get real data, but if it's any indicator for me, I think it's just the tip of the iceberg in terms of what we will experience going forward.
Yeah, I would, second that. I haven't looked at this recently, but I remember a couple of years ago, the predecessor to Data Loss TV was privacyrights.org, and privacyrights.org did the same thing. It enumerated all the breaches that were in the public domain, and we looked and added up all the breaches and the number of records breached that were listed on that website, and then we looked at all the breaches that we investigated. We investigated more breaches than were on privacyrights.org. Right, and there's others like Verizon investigating these breaches, so definitely it is the tip of the iceberg. The example that was given earlier, when there are internal breaches, often those go unreported. So our findings are that 14% of the data the breaches we looked at, only in 14% of those cases was there an internal actor involved. And that would make sense because we get our caseload, a lot of it comes from law enforcement. Law enforcement really only gets involved when there's an external party involved. So if it's an internal action, then the organization fires them, and that's that. So that's one thing. And then the one clarification I'd ask for is your question. When you say what should we be looking for, are you thinking of this from a individual patient's perspective or from an enterprise organization's perspective?
Well, I mean, to me, from the standpoint of where clinicians and hospitals, configure their
Sure.
security, it's one thing, but, again, in terms of having some kind of radar out there to
Sure.
even know
That
is another,
something's
and
happening.
that's kind of.
So I'll tell you right now, we are really, as an industry, I mean, healthcare and even across industries, we're not very good at identifying a breach has happened. I'll share some statistics. So for the bad guy to break in 84% of the cases, it takes them hours or less to break in. From the time that they break in to the time that the breach is discovered, in 78% of cases, it takes weeks or more to discover that a breach has happened. Right? So that gives you an idea of how good we are. Only in 1% of cases is the breach identified by looking at the logs. In probably over 80–90% of cases, the proof of the breach was in the logs. We're not very good at identifying that.
The proof is in the what?
In the logs. In the logs. In the audit logs. And so one other statistic, and probably about 75% of cases, it's a third party that actually informs the victim that they've been breached. 9% of cases, it's the customer that tells the organization they've been breached. So let me step back from the stats and theorize on what I think that the problem is. One of the problems is we've been introducing a lot of security controls, and I like the term control freak, but in the controls context, we focus so much on controls and adding more and more controls. We haven't quite done a very good job of operationalizing those controls. So whether they be IDSs, whether they be, firewalls we're good with, but IDS, anything that produces a lot of logs, the hard part is not implementing them. The hard part is actually managing them and doing something with them to actually extract value from them. So, the evidence of the breach is in the logs. We're not doing as good a job of going through the logs. What's happened is you could think of it simply as the haystack is getting bigger and bigger and bigger. Our ability to identify the needles in the haystack isn't getting bigger. This is part of a much longer conversation, but our approach at Verizon is, yes, we're going to introduce better analytics to identify the needle, but another thing we have to do is we have to reduce the number of logs. It sounds like the right thing to do, log more because we may need it, but in fact what that does is when there is something that bad that happens, it makes it much harder to know that it happened. So reducing the amount of logs in the environment is actually a good thing to look at.
The trend is and it hasn't hit healthcare yet, but if you look at the companies that are very serious about breaches, those that have classified information or financial information, They've increased the amount of security operation centers in their organizations. They monitor more carefully. And I don't know if any of you guys have SOCs running in your outfits, but that's helped a lot. It's not just the logs, it's real-time looking. And then the big trend right now is information sharing. I don't know if that's going to work or not. I've been active in the defense industrial base, which is the DoD version of that you had to have a clearance to go listen to, which was stupid because the information couldn't be shared with anybody once you shared it amongst yourselves. And now DHS is trying to just fix that out of the executive order. But that's another element that has to happen. People have to be able to share. Now, and this is the last thing I'll say. I don't mean to hog everything here, but the other thing is, if you're a publicly traded company, they want you to make disclosures in your reporting requirements under the IRS rules, and even those companies aren't. I mean, we've heard of people with big breaches told us at the DIB and then never disclosed it in their IRS reporting. So it's just how truthful do you want to be? Does it hurt you? Your profits can go down, we said earlier. So, I mean, it's very complicated.
I think you addressed the fact that there's a gap. So the gap does not exist at the security professionals level. Because what happens at the security professional, where these guys are at, okay, they probably go to black hat conferences and they know that between them and an adversary, there's a set protocol to be able to understand, to be able to pick up the data and understand when you've been breached and to protect the data. So at that level, that's a very, very formalized, very highly technical, very highly advanced working, essentially. On the policy level,
There's a lot of other pieces of that as well. It's
But
a very highly paid person.
and highly paid. But then when you get to the C-level executives, which we're talking about here, and having that conversation with the business person who writes right on the webpage, we employ the best security, and we take your information highly, we're very serious about it, which you said about the John Hopkins. I was saying, wow, they're being honest. Because I went to a HIP conference up in Boston with one of the main prosecutors, and he said, we can't protect against this stuff. They're checking off these MU2 risk assessment compliance lists, and they're not even doing the risk assessments. They're just getting the money in.
Yeah,
So,
I think transparency is a
The important thing for the non-lawyers to understand is that in the United States, there's no affirmative obligation to protect. We have a reactive system
right.
that requires you to notify when you find out, which would incentivize head in the sand, because if you don't find out, you don't have to notify. So only Massachusetts has taken a proactive approach with general information about the citizens of the Commonwealth of Massachusetts to say, here are the controls you must have in place if you hold this kind of data, not dissimilar to the S800-53 or the ISO 27001. So everyone seems to think that everyone cares about this stuff, and they don't. The corporations are not going to care about it because there's no affirmative obligation to do anything. So what you should care about is trying to change things to make it so that there's an affirmative obligation to actually have security to protect.
Right, and sorry, I'm going to keep an eye on the time. I think we're coming. Leo and Bill, I think you may have. You have any kind of closing remarks or anything else you want to?
I just look at it. The problem is going to get worse before it gets better. If you look at the accountable care organizations that are coming out and everything else, you have these nurses that are going to be in the field instead of having it controlled in the hospital. You're going to have nurses in the field, especially if you're talking about rural health care. So you have to set up protections for them out in the field. One statistic that just kind of boggled my mind, and I didn't think it was probably true until I read something this morning, but it was saying that the genome typing, about 34,000 people have been genome typed as of today. By 2020, that'll be 2 billion. Now, my first thought was, it's so expensive, but a Chinese scientist said that probably by next year you'll be able to get it down to less than what an iPhone costs, which, if you're $700 or $800. So all this data is coming and it's all going to be stored. And, we're going to have to do something like that to The other thing you have to look at is we're producing some of it, a lot of our own healthcare information. And this was brought up, a guy told me, go home and look how many points you have into the internet in your home. I have a one-bedroom apartment, I counted 43. You know, everything from weight scale to, you know, Fitbits, to how my television connects, you know, how I surf and everything else. So the data is growing larger and larger and larger. We kind of kidded at the beginning here, you know, maybe it'll get so large that no one can find us. You know, but I think, you know, we're at the birth of analytics. No one's figured it out yet. And, you know, they will figure it out. And I'm not a, you know, a stop technology type person. I think it's coming. If we don't control it kind of in the beginning, you know, then we're gonna have problems down the road. So, you know, we have to embrace the technology because people are going to use it. Not everybody sits in a room, you know, or in a building like this and discusses privacy and security. They just think it's really cool to have an iPhone that does this.
Relevant to your point, and I think it's.
Sorry, I apologize to cut you off. I want to be respectful of everyone's time. Give Leo just a.
I was going to agree again. I think the problem is going to get worse. I tell our new employees my security program is here to make us more difficult to break into the next guy so they can go bug Bill or somebody else. But I do worry that as taxpayers, as an industry, we're making a huge investment, and when the huge problem comes, there's going to be a big backlash about it. And I hope as an industry we can prevent that one way or another.
Thank you. Sorry to cut you off. I do want to try and keep to the schedule as much as we can, and I believe we're out of time, right? So I do appreciate you all coming by. If the panelists don't mind, we stick around for a little while here, and if you have any other specific questions or would like to have further conversation, you'll be glad to do so. So thank you for coming by.
Off the cover there, I just want to add to your point that pharmaceutical companies have been very lucky in being able to do big blockbuster drugs. So things like the Adler, there's a lot of money in them protecting that data. They do that through Safe Biopharma, Verizon's involved in that. So it's all very secure. It's very highly guarded intellectual property. But as the ability of these pharmaceutical companies to do blockbuster drugs starts to decrease, which we're starting to see, they're going to reach deeper into people's data, do more customized and cheaper if they can do it, very specific genomic-based medicines out in the future. And then they're going to want to data mine that, and then that's the point where all these things start to converge about people's own coding that they're carrying along for thousands of years starts to become relevant. And that's where the genomic is going to be like a whole another negotiation point, I guess it's bad. It's a financial negotiation point because they're going to derive, and they can derive incredible value by personalizing that relationship because it's not one size fits all. So I think you're on the cusp of a great idea there.
When they're talking about, you know, 3D printing of drugs in your home. Yes. You know, and that's what the, you know, the genome will decide. You know, to be printed in your own home.
And on the criminal side, let's take the criminal flip side. What happens when something gets flipped? There's a bit flip, you lose the integrity, and all of a sudden, that doesn't help you.
Yep, that's very true.
They've been looking at that for years.
Is for drugs, it gives information
Oh,
about drugs.
a lot of this is we're in the infancy of this.
Pharma.
That's what we have to.
That I know.